please don't ignore this. Neglecting your sexual health after 60 can seriously affect your overall well-being. Let's talk openly about what truly matters: senior sexual health. For many, the topic of sexual health after 60 feels like a hushed secret. A subject to be avoided due to embarrassment, outdated taboos, or simply a lack of understanding. But what if we told you that sexual health in your later years isn't just about intimacy in the traditional sense? It's profoundly connected to your emotional well-being, your sense of self-esteem, and even your physical health. It's a vital, often overlooked, aspect of healthy aging. And it's time we brought it out of the shadows and into the light. Today, we break the silence. We're offering a respectful, honest, and empowering look at senior sexual health, designed to help you understand, navigate, and embrace this important part of life's journey. This isn't just about physical acts, it's about connection, joy, confidence, and the freedom to experience a fulfilling life, regardless of age. You might be asking, why talk about this now? Because the vibrant tapestry of life continues to unfold as we age, and every thread, including our sexual health, contributes to its richness. Ignoring it can lead to feelings of isolation, diminished self-worth, and even a decline in overall health. But by addressing it openly, we unlock the potential for deeper connections, greater happiness, and a more robust sense of vitality. First, let's acknowledge that changes are natural. As we age, our bodies evolve, and so too does our experience of sexual health. This can manifest in various ways, from shifts in libido to physical changes that might impact comfort or function. For women, the post-menopausal period brings significant hormonal changes that can affect vaginal dryness, elasticity, and overall arousal. For men, changes in testosterone levels or blood flow can influence erectile function. These are normal parts of the aging process, not deficits, and understanding them is the first step toward managing them effectively. One of the most common questions revolves around changes in libido. It's true that for some, sexual desire may naturally decrease with age. This can be due to hormonal shifts, but also lifestyle factors, chronic health conditions, stress, or even relationship dynamics. However, a decrease in libido is not an inevitable outcome for everyone. Many older adults maintain a healthy, active sex life well into their 70s, 80s, and beyond. The key is to understand what might be influencing your own experience, and to explore solutions that align with your individual needs and desires. Medications play a significant role in the lives of many seniors, and it's crucial to understand their potential impact on sexual health. A wide range of commonly prescribed drugs, including those for blood pressure, depression, anxiety, prostate conditions, and even allergies, can have side effects that affect libido, arousal, or function. It's not uncommon for individuals to experience these side effects without realizing their medication is the cause. This highlights the absolute necessity of open communication with your healthcare provider. Never stop taking a prescribed medication without consulting your doctor, but always feel empowered to discuss any concerns about sexual side effects. Your doctor can often suggest alternative medications or strategies to mitigate these issues, ensuring your overall health and well-being are both prioritized. Now, let's talk about a topic that is often overlooked: safe sex after 60. The notion that sexually transmitted infections, or STIs, are primarily a concern for younger populations is a dangerous misconception. In reality, STI rates among older adults have been rising. This can be attributed to various factors, including increased sexual activity in later life, less emphasis on contraception education, which often bundles STI prevention, and a lower perception of risk. It's absolutely vital to continue practicing safe sex, regardless of age. Consistent and correct use of condoms remains the most effective way to prevent the transmission of STIs. Open and honest conversations with new partners about sexual health, history, and STI testing are also paramount. Your sexual health journey doesn't end with youth. Neither does the responsibility to protect yourself and your partners. Embarrassment, fear of judgment, or a lack of knowledge often prevent older adults from discussing sexual health with their partners and healthcare providers. But these conversations are essential for a fulfilling and healthy sexual life. Let's consider how to approach them effectively. When talking with your partner, choose a quiet, comfortable time when you can both speak openly without interruption. Start by expressing your feelings and concerns from a place of shared intimacy and understanding. For example, you might say, "I've been thinking about our intimacy lately, and I'd love to talk about how we can both feel more connected and satisfied." Be specific about what you're experiencing or what you'd like to explore, and, most importantly, listen actively to your partner's thoughts and feelings. Remember, intimacy encompasses much more than just sexual intercourse. It includes affection, emotional closeness, and shared experiences. Re-evaluating what intimacy means to both of you can open new avenues for connection. When it comes to speaking with healthcare providers, remember that they are professionals, trained to address all aspects of your health, including sexual health. Don't wait for them to bring it up, you initiate the conversation. You might say, "Doctor, I'm concerned about changes in my sexual health, and I'd like to discuss them." Be prepared to describe your symptoms or concerns clearly. Don't be afraid to ask questions about potential causes, treatment options, or referrals to specialists like urologists, gynecologists, or sex therapists if needed. A good healthcare provider will approach this topic with professionalism and empathy, helping you find solutions that enhance your quality of life. It's important to recognize that a healthy sex life after 60 is supported by overall well-being. The insights from web searches on senior sexual health management methods emphasize several key areas. For instance, maintaining fundamental physical health through a balanced diet, regular physical activity, and adequate sleep is crucial. A diet rich in plant-based foods, minimizing processed items, can support vascular health, which is directly linked to sexual function. Nutrients like arginine, found in nuts, and zinc, abundant in oysters and shrimp, are highlighted for their beneficial effects. Think of your body as a finely tuned instrument. What you feed it directly impacts its performance, including its capacity for intimacy. Physical activity isn't just about maintaining weight. It's about circulation, energy levels, and mood. Regular exercise, particularly lower body strength training and Kegel exercises, can significantly enhance sexual function for both men and women. Light activities like walking, dancing, and yoga are gentle, yet effective ways to keep your body vibrant and ready for connection. The goal isn't strenuous exertion, but consistent, enjoyable movement that keeps your blood flowing and your muscles toned. Sleep is often underestimated, but it's a cornerstone of health. For those over 60, aiming for at least 7 hours of quality sleep nightly supports hormone balance, energy, and overall well-being, all of which contribute to a healthy sexual life. Think of sleep as the body's essential repair and rejuvenation cycle. Social engagement also plays a vital role. Social isolation can lead to cognitive decline, depression, and weakened immune function, all of which indirectly impact sexual health. Maintaining social connections and engaging in activities that stimulate your brain contribute to a more positive outlook and overall vitality, which are fundamental to a healthy, intimate life. The message is clear: sexual health is a part of aging, and it's time we treated it that way. It's not a fringe topic or something to be ashamed of. It's a core component of a fulfilling life, just like any other aspect of your physical or emotional well-being. Embracing this perspective allows for greater self-acceptance, deeper intimate connections, and a richer overall life experience. We've talked about the importance of open communication, understanding the impact of medications, practicing safe sex, and building a foundation of overall health. Remember that for men, sexual activity can continue throughout life, as long as overall health is maintained. The ability to produce sperm persists, meaning fertility, while reduced, can extend well into later years. For women, post-menopause can even bring a sense of liberation, as the concerns of pregnancy are no longer present, allowing for a different kind of freedom and enjoyment in sexual activity. In conclusion, senior sexual health is a dynamic, multifaceted aspect of aging that deserves our attention, respect, and open discussion. It's about empowerment, about choice, and about maintaining a quality of life That includes intimacy, connection, and joy. Don't let outdated ideas or discomfort prevent you from exploring and cherishing this important part of your journey. Seek professional advice when needed, communicate openly with your loved ones, and embrace the ongoing possibilities for intimacy and connection. Your body and your spirit are still capable of incredible experiences, and your sexual health is an integral part of that beautiful story. It's time we treated it with the honesty, dignity, and care it deserves. If you found this helpful, please subscribe and take good care of your health.